All right, so first I just wanted to start out telling you a little bit about myself and about Central New York Lyme support, and then I'll get into a bunch of the details on how to prevent Lyme disease. So I grew up locally here in Chittenango. I graduated in 2002, and then I went on to Clarkson University and studied electrical engineering, and I met my husband there. His name is Josh. And after we graduated, we got married, and we moved back to this area. We both work for a local engineering firm, and I love my job. I love the problem solving and the analysis and the mental challenges there. But about 3 months after we got married, then I started feeling really tired, to the point where I couldn't work a full day. I needed to take a nap, or I just couldn't make it through the whole work day. And I also had some cognitive symptoms where I couldn't think through things as well, even if I wasn't totally exhausted. Had some focusing issues. So I saw a lot of doctors, had a lot of lab work done. All the lab work came back saying I was normal and healthy. But I was gradually getting worse, and I eventually had to stop working altogether. And then I saw a doctor who specializes in Lyme disease, and he diagnosed me with Lyme and started treating me. And then over the course of 15 months or so, doing treatments, I gradually got better, and I was about back to normal, but then I had a relapse. And so since then, I've been trying to treat this relapse. So it's been about 5 years total that I've been sick, and there's been a lot of tough times through that sickness, but I've seen God's grace again and again through this time. I've seen how when I didn't know what was wrong with me, then friends of friends kept contacting me and saying, "Have you considered Lyme disease?" And then when I went to see the Lyme doctor, he wasn't accepting new patients, but God provided a way for me to get in and to see him. And then my insurance covered 8 months of treatment, where every insurance only covers 1 month, but they approved me again and again. And God has given me strength and perseverance through this illness, and even blessed me through it, as it has pushed me to develop deeper relationships with people, and I have the opportunity to share what I've learned with others and to help them not to be as sick or to prevent Lyme. So last year, a few other local people and myself, we started a group called CNY Lyme Support, and we just try to raise awareness about Lyme disease, give people information about how to prevent it, about how to diagnose it, to encourage people who are sick with Lyme, and we have a monthly support group as part of that as well. So now we'll get into some of the details here. So the first thing I'm going to cover is basically what Lyme disease is, and then why it's important to know about Lyme disease. And then we'll focus a lot on what each of us can do to prevent Lyme disease. So first, Lyme disease is a bacterial infection. You get the bacterial in your system by being bitten by a tick. The ticks that we have locally that could transmit Lyme disease are the black-legged deer tick, and I don't think the Lone Star tick is very common around here, but it also transmits Lyme disease. The bacteria is classified as a spirochete. There's a picture over there. It's spiral-shaped. Lyme disease can cause a whole range of symptoms. Some of the most well-known include a rash, especially a bullseye rash, or joint pain, chills, fever, fatigue, flu-like symptoms, or partial facial paralysis. But there's a whole other bunch of symptoms that it can cause too. headaches, anxiety, lightheadedness, poor memory, chest pain and palpitations, numbness and tingling, and even a bunch of other symptoms that aren't listed on here. Now, each person experiences a different set of symptoms. It depends on what strain of bacteria you get in your body and where it travels in your body and what it targets. So each person would just have a subset of the symptoms. For example, my primary symptoms have been fatigue and difficulty concentrating, and the other symptoms I've had are highlighted in red there as well. Since it's caused by a bacteria, it's treated with antibiotics. Lyme can be treated with oral antibiotics, with intramuscular injections, with IV antibiotics, or with herbal antibiotics. And I have done a form of all of these. I've tried them all. All right, so why do we even need to know about Lyme disease? There's several reasons, and I'll go over each of them in more detail. But the first is that we are at risk here in Central New York. Ticks and Lyme disease are around here in this area. Another reason is that Lyme disease is hard to diagnose, and the medical community is divided on how to diagnose and treat Lyme disease. But Lyme is treated most effectively when it's caught early and treated immediately. So that means that it's often up to the patient to recognize that they have Lyme and to do something about it, rather than waiting for their doctor to figure it out. So people in CNY are at risk. Ticks like to hang out in vegetative areas, in the woods especially, in leaf litter, but they can also be found in our lawns and in our gardens. And the ticks in this area, about 2 out of 3 of the ticks carry the Lyme disease bacteria. And this was discovered in a study at Green Lakes where the adult ticks were collected and analyzed to see if they carry the bacteria. And they found that 63% of them carry it. And I take this number as representative of all of Central New York and not just the park being really bad, because ticks aren't confined to the park and they travel on animals and move around, and it just doesn't make sense that it would be an isolated location. But this would be representative of all of Central New York. So Lyme disease is hard to diagnose because there is not a simple blood test that tells you if you have it or not. The CDC has stated that Lyme disease is a clinical diagnosis. So your doctor decides if you have Lyme based on your symptoms, based on your possibility of exposure to ticks. Now, clinically, it's actually not that hard to diagnose if you have one of the classic symptoms, especially following a tick bite. If you get a bullseye rash, or if you have joint pain after being bitten by a tick, or if you develop partial facial paralysis, then that's a giveaway that you have Lyme disease. However, less than half of the people with Lyme disease remember being bitten by a tick at all. It's easy to overlook a tick bite. And then less than half of the people with Lyme disease, again, remember any rash at all. And then even though the bullseye rash is most commonly associated with Lyme disease, it's not even the most common rash shape that you could get with Lyme. So all these factors complicate the diagnosis. And in my case, I never saw a tick bite me. I never saw a rash. Now, for the blood test for Lyme disease, there is a 2-tiered testing system. The first level screening test is called the ELISA, but that has a false negative rate of 35%. And only if you are positive on this blood test do they go on to perform the Western blot. And the Western blot has a false negative rate of 20 to 30%. And in order to be considered positive by the blood test, you need a positive on both of these tests. So that's less than 50% accuracy for the blood test. And I was tested for Lyme disease within the first few months of being sick. Maybe 3 or 4 months into being sick, I was tested for Lyme disease, and it came back negative. Another factor that makes Lyme hard to diagnose is that each person presents with different symptoms. And on top of that, when you're bitten by a tick, you might not just get Lyme disease, but other infections as well. So there's these other organisms like Ehrlichia, Anaplasmosis, Bartonella, Rocky Mountain spotted fever, Babesia. You could get these at the same time, presenting additional symptoms, making it hard to figure out what's going on, and making it hard to treat. And then because Lyme can affect so many different body systems, present with so many different symptoms, it can often be misdiagnosed as other conditions like chronic fatigue, fibromyalgia, multiple sclerosis, Parkinson's. So Lyme can be misdiagnosed as these other conditions, and really a person needs antibiotics rather than being treated for these other conditions. But it works the other way around too. You might be diagnosed with Lyme disease when really you have one of these other conditions. Now, the medical community is really divided on Lyme disease about how to diagnose and treat the disease. There's some doctors who sort of have the philosophy that Lyme is hard to catch and easy to treat, that it's no big deal. They say that there's no such thing as chronic Lyme disease, that there could be a persistent infection. They don't think that can happen. 4 weeks of antibiotics, they say, should be enough to get rid of Lyme disease. And after that, if you have any symptoms remaining, then it's called post-Lyme syndrome, and you're just left with that. On the other hand, you have doctors who say it's not that rare, and if it's not treated immediately and effectively, then Lyme can become a persistent infection, becoming chronic Lyme disease. And they also say that sometimes months of antibiotics are required to root out that infection, and that lingering symptoms reflect that ongoing infection. Now, from my experience, I tend to side with the doctors on the right-hand side. That's the philosophy of the doctor that's treating me, and I'm thankful for that because when I first started antibiotics, I didn't notice any difference at all for the first 2 months. I just felt the same. But after 2 months, I gradually started getting better on antibiotics. So if I had been cut off after 4 weeks, then I wouldn't have made any progress. So since it's very difficult to diagnose, there's not a clear blood test, really a lot of doctors aren't equipped to make the clinical diagnosis. They just don't have all the knowledge or experience needed to recognize Lyme disease. So a lot of times it's up to the patient to figure out what's going on and to seek answers. But the disease is treated most effectively when it's caught immediately. So that's why it's really important for each person to know something about it and to be able to recognize it.